Hello and welcome. Today we are diving into an important topic. Do you know what is NPC is? No, it's not a character in a video game or something you have seen in a sci-fi movie, but NPC stands for nasopharyngeal cancer, a silent but a serious disease that affects the area of your nose and also the mouth. It's a condition that many never heard of, but it is one of the most common cancer in the Asian population, especially here in Malaysia. Let's uncover facts about NPC and why it matters. NPC is particularly prevalent in Southeast Asia, with more than 83% of global cases occurring in Asian populations. In Malaysia, the risk is notably higher among the Chinese, particularly the Cantonese group. This makes the NPC a significant public health issue in these regions, where awareness and also early detection can save lives. So what increases the risk of developing an NPC? Here are the major factors. Firstly, food that is high in nitrosamines, which are carcinogens that can interact with DNA and trigger the oncogenes, the genes that promote the cancer. Next would be smoking and alcohol consumptions, which are the major contributors introducing harmful substances into the body. The third one would be genetic predisposition. Some individuals have a higher genetic susceptibility to the NPC. The fourth one would be the Epstein-Barr virus, known as EBV virus, a virus that can remain dormant for years. Then it interacts with the genetic factors to activate the oncogenes and also trigger the NPC when it interacts with any of the smoking alcohol compounds or the nitrosamines. So, how do you recognize the symptoms? The signs of NPC can be quite subtle in the beginning, making early diagnosis challenging. So, the key symptoms include neck swelling, a painless lump on the side of the neck is often the first sign. It might be unilateral, meaning only one side, but it can also affect the both sides. Next would be nasal symptoms, where these can include the blood in the nose, nasal obstruction, difficult breathing through one side of the nose. Then, third problem would be the ear problems. These might include the ear pain, a sensation of fullness, ringing in the ear, known as tinnitus, or fluid drainage from your ear. In some cases, the eardrum might rupture. So, next would be the vision problem, where blurry or double vision may occur if the cancer spreads to the eyes or affects the surrounding nerves. If you notice these symptoms, don't wait. Consult with your healthcare provider. The gold standard for NPC diagnosis is a biopsy, where a tissue sample is taken from the affected area and analyzed under the microscope to confirm the presence of the cancer. Once diagnosed, the treatment for NPC typically involves a combination of radiotherapy and also chemotherapy. NPC is particularly sensitive to radiation, which means radiotherapy can be highly effective, especially in the early stages. Chemotherapy is used in the combination with radiotherapy to target the cancer cell that might have spread. Awareness is key in preventing and managing the NPC. Educating communities about the risk, symptoms, and importance of early detection can make a huge difference. Hosting health talks, distributing informational pamphlets, and sharing knowledge through the social media can reach a wider audience, particularly in high-risk areas. Promoting regular health screenings and also advocating for lifestyle changes like reducing the consumption of salted foods and quit smoking can lower the risk significantly. Awareness about NPC is very crucial, especially in high-risk communities. If you or a loved one experience any of the symptoms that have been mentioned just now, don't delay. Early detection saves lives.